Welcome. Today, we're going to talk about a common medical condition that's recently been in the headlines, chronic venous insufficiency, or CVI. We'll explore what it is, its symptoms, and how it's diagnosed, as well as address recent discussions about public figures and their health. So, what exactly is chronic venous insufficiency? Our veins are responsible for carrying blood back to the heart. In our legs, this is an uphill battle against gravity. To help, veins have tiny one-way valves that open to allow blood to flow upwards and then close to prevent it from flowing backward. Chronic venous insufficiency occurs when these valves become damaged or weakened. When they don't close properly, blood can leak backward and pool in the lower legs. This pooling of blood increases pressure in the veins, leading to a range of symptoms. It's a condition that can affect superficial veins, deep veins, or the perforating veins that connect them. It's also known as chronic venous stasis. The symptoms of CVI can vary in severity and tend to worsen over time if left untreated. Initially, people might experience a dull ache, cramping, or a heavy feeling in their legs, often improving with elevation. Leg swelling, particularly around the ankles, is also a very common early sign. As CVI progresses, you might notice visible varicose veins, which are enlarged, twisted veins close to the skin's surface. Skin changes are also characteristic, including itching, redness, or even crusty patches, known as stasis dermatitis. Over time, the skin around the ankles can become thickened, hardened, and discolored, often turning a reddish-brown due to iron deposits from pooled blood. In more severe cases, chronic non-healing ulcers can develop, typically around the ankles. Other symptoms can include a tingling sensation, pain that worsens with prolonged standing and improves with leg elevation, and sometimes even restless leg syndrome or painful muscle. CVI can be caused by various factors. Common culprits include a history of deep vein thrombosis, which are blood clots in the deep veins that can damage the valves. Other risk factors include obesity, prolonged standing or sitting, a sedentary lifestyle, pregnancy, and a family history of CVI. It's also more common in middle-aged or older individuals, especially those over 50. Diagnosing CVI typically involves a physical examination where a doctor will assess your symptoms and examine your legs, both standing and sitting. The most common diagnostic test is a duplex ultrasound. This non-invasive imaging technique uses sound waves to visualize the veins and evaluate blood flow, allowing doctors to identify valve dysfunction or blockages. In some cases, if more complex issues are suspected, other imaging tests like Mr. Venography or CT venography may be used. Trump's diagnosis and the broader context. Now, let's address the recent news. President Donald Trump, at 79 years old, was recently diagnosed with chronic venous insufficiency after experiencing leg swelling and hand bruising. The White House, in a statement, clarified that this is a benign and common condition, particularly in individuals over the age of 70. His physician confirmed that there was no evidence of deep vein thrombosis or arterial disease, and other lab results were within normal limits, with normal cardiac structure and function. It's important to understand that while the term chronic might sound alarming, CVI is generally not a life-threatening condition. It can significantly impact quality of life, but with early detection and appropriate management, symptoms can be alleviated and progression slowed. Treatment often begins with conservative measures like compression stockings, which help support the veins and promote blood flow back to the heart. Lifestyle modifications such as regular exercise, elevating the legs, and avoiding prolonged standing or sitting are also crucial. In some cases, minimally invasive procedures like laser treatment or sclerotherapy may be used to seal off damaged veins, or, in more severe cases, surgical options like vein bypass might be considered. The bruising on Mr. Trump's hand was attributed to minor soft tissue irritation from frequent hand shaking and the use of aspirin as part of his cardiovascular prevention regimen. This highlights that many symptoms can have multiple explanations, and a thorough medical evaluation is key. Chronic venous insufficiency is a prevalent condition that affects millions, especially as we age. While it can cause discomfort and impact daily life, it's generally manageable. If you experience persistent leg swelling, pain, skin changes, or visible varicose veins, it's always advisable to consult with a healthcare professional for a proper diagnosis and treatment plan. Early intervention can make a significant difference in managing this condition and improving your overall well-being.